Welcome back, ladies and gentlemen. Still with you, and today's edition of Cairo Local Time. And of course, today we're delighted to be joined this afternoon in the studio by our guest, Dr. Apryle Horbal, member of the U.S. Chamber of Commerce. Dr. Apryle, thank you so much for coming in this afternoon.
Thank you for having me.
And welcome to Egypt.
Thank you.
So you've only been here for 24 hours.
Yes,
Okay,
yes.
so thank you so much for coming in and making the time. I'm sure you're tired and jet lagged.
Yes.
But thank you so much for joining us.
No, I very much appreciate you having me.
Thank you very much, Doctor. So first and foremost, tell me the purpose of your visit.
Yes, absolutely. So we're here to explore some opportunities in health in Egypt, in both veterinary and in human health care.
Okay.
Specifically looking at telemedicine and telehealth. So that's an industry that really expanded in the U.S. during COVID especially. And so we're looking at how we can take what we've done in the U.S. and really apply it to the Egyptian market.
So let's talk a bit about telehealth. Tell me exactly what this entails. Lots of people think it's, meeting your medical practitioner online, on a meeting online, and getting a diagnosis, and that's it. So tell me a bit more in depth.
Right. So that's at a very basic level, that's what it is,
Yes.
right? But really it's about moving healthcare online. So not just that meeting with your doctor, but the ability to receive prescriptions. It's the ability to speak with nurses and the ability to speak with specialists as well. So not just your doctor, but to learn about, oncology, cardiology, dermatology, and have that specialist connection too. And then telehealth. So telemedicine is what you're talking about, that one-to-one video connection. Telehealth really allows you to manage your healthcare differently. So what we do now involves much more than that one-to-one interaction. It really involves looking at the whole person.
Okay.
So looking at how physical and mental health can be combined and social health can be combined. Looking at how people respond to different things in their environment. Looking at health trends, which members in the community have which illnesses, and really becoming more proactive with healthcare. And so getting in front of issues as opposed to responding to them.
And how about the availability, for example, of your medical files, medical history? If you need to, see several specialists or share this kind of information, is this like database also included?
Exactly, yes. It's having access to all that information in one place.
So it's not just for humans, you mentioned
Animals,
Animals,
yes.
tell me a bit
so
more.
I'm actually a veterinarian,
Okay.
so I
passion for
yes,
animals.
absolutely. And really, it's about two types of veterinary care, and the first being pets, of course. And so really getting people connected with their veterinarian or with a veterinarian if they've never had one. We're really looking at the market here, seeing what the veterinary market's like, and we know a lot more people are coming to own pets now. But even if you look at the U.S., a lot of pet owners, 50% of people that have cats actually have never taken them to a veterinarian. So really telehealth in the vet space is about making even that first connection, with a vet, making it easy for people to talk to a vet and access a vet. Similarly, when you look at the veterinarians that work on food-producing animals, so, poultry, chickens, cattle, things like that, there aren't enough people that do that vet work to really keep our food supply safe. And so it's really about extending those vets too. Instead of them having to drive hundreds of kilometers between locations, they're able to do it remotely then as well and do those visits online. And so it's really two different things. When you look at the veterinary market in the U.S., it's really 50-50. The number of animals, the amount of veterinary care required, and the business is 50-50.
So the whole concept of telehealth or telemedicine really, came to light during the coronavirus pandemic.
Yes.
Did it exist before that?
Yes, absolutely. So in the U.S., really telehealth and telemedicine for people has been around for 20, 30, 40 years. And really at a simple level, a phone call with your doctor is telemedicine. It is, right? So
virtual,
yes, exactly. In the veterinary space, it's really been around formally since about 2018. So it's new, but it did exist pre-corona.
So your visit to Egypt is to see, avenues for expansion of this issue in Egypt. Tell me exactly what you'll be doing, how you will be approaching this, topic here inside Egypt, especially with the handling of the coronavirus pandemic in Egypt, just finishing up our third wave successfully, thank God. So tell me what you're planning to do during your visit.
No, absolutely. So a lot of our visit centers around speaking with leaders in the industry. So doctors, a lot of doctors, a lot of veterinarians that have hands-on experience in the field, and then a lot of leaders in business, in adjacent business to people involved in the pharmaceutical industry, people involved, in the medical records industry, things like that. And then as well, some meetings with regulators, people that are involved with the government in licensing and regulation of both veterinary and human health care.
And also the telecommunications sector is very important for this project to kick off.
Yes,
is that correct?
It is, yes.
How dependent are you on this?
So it is a bit of a topic, right? A hot topic. And it's even something, in the US that we've dealt with. We work in Canada a lot, and they have a lot of issues with cellular service and coverage. And so we've created a lot of solutions to, being able to have a live stream video chat is best, of course. But we've had to create a lot of solutions to allow, we call it store and forward, right? So where you take a picture and you send it, or you send a protected, a stored file, a text message, something like that. And so, a lot of accommodations have been made for the fact that there are many varying levels of cellular broadband internet service available everywhere.
Right. So in the United States, over the last couple of years, a lot of challenges because of the coronavirus pandemic, especially in the health sector. Really, they've been challenged and pushed beyond limits, but they have really given it their all, especially here as well in Egypt. We call them the White Army in Egypt because it was definitely a war against, the virus. They've come a really long way. How will something like telemedicine or telehealth assist these, White Army soldiers, as we call them, in really carrying out their job in a satisfactory manner and even in the hardest of circumstances, having them somehow available and accessible. Usually accessibility is a challenge during a pandemic like this. You really don't want to go to the hospital, even if you're not feeling well. You'd rather, stay at home, stay away from hot zones, etc. So tell me a bit about how this is supposed to assist them.
So it's that's a loaded question. So
yes,
there are many ways that it can help, right? So in the first instance, when you're talking about people not wanting to go to the hospital, right? And absolutely, we saw a sharp decline in people accessing kind of more elective services at the height of COVID. And people's health suffered because of it, right? More people were dying of heart attacks and things like that at the height of COVID. And so really it's about accessing that specialty and elective care from home or, from a satellite location where it is a bit safer that makes the patient more comfortable, for sure. On the side of the healthcare providers, the doctors, the nurses that are very burned out by COVID, a lot of them are actually leaving the clinical practice now because they just can't take it anymore. And so this really provides a better balance for them, right? They can still see many patients a day. They can see 50 or 100 patients a day, but by doing it virtually, it allows them to really then have that comfort of either they do it from home, they do it to make maybe some supplementary income as well, that's a possibility. And the other possibility too is that they have a better work-life balance then, right? So when they turn off, their computer at the end of the day, they're done with work. They're not getting emergency calls from their patients in the hospital or, patients at home afterwards. So it's really both those things. It's better, it allows the services to be extended for the patients and allows the doctors to live a more balanced life.
So doctor, tell me a bit about, the cost effectiveness of something like telehealth or telemedicine. Is it more accessible for lower income earners, for example, even with the technological barrier that could be an issue, or not? Tell me a bit more.
It can be, yes. So it can be much more accessible for people that if they don't have the amount of money it takes to see a doctor or a veterinarian in person, it absolutely can provide a more cost-effective visit. By the same token, it really can allow people, maybe people that need to see a very high-level specialist, they could see an international expert via telehealth for a much reduced cost.
So we're also talking about crossing, borders.
Exactly. Yes, absolutely.
And that's very important as
Yes.
well. So tell me, doctor, what's your next step after identifying, all the players that could be involved in this project as member of the, U.S. Chamber of Commerce and this project that's going to take part?
Absolutely. So we're already planning to come back in a few weeks because there's so much more to learn, right? But we really are in the process of building some launch plans, talking about how we would involve people on the ground here, how we would involve doctors and nurses and medical staff here and really start to implement this in Egypt specifically.
Well, you've only been here 24 hours, so I'm sure you haven't really had time to see a lot or meet with a lot of people, but your impression so far of Egypt, your impression before you came and now that you're here?
No, it's very dynamic, right? It's been a very exciting 24 hours for sure that we've been here. We did get the chance to go and see the new mummy exhibit actually this morning, and so that was very special. But of the people, it's a very dynamic, it's a very forward-thinking society, and it's been a real pleasure to get to know the people in person, and we've met a lot of colleagues on Zoom before this too.
Okay, so it's not a first-time meeting.
It's not. So it's
tell
been
me,
great.
Doctor, do you have a bit of information about the volume of trade exchange, for example, between Egypt and the United States in the last couple of years, especially with the pandemic? Things kind of came to a halt, and now things are picking up again. Could you tell us a bit about that trade exchange between the two nations?
No, it certainly seems like it is picking up again, right? So as I hesitate to call it the end of COVID. Hopefully we're approaching the end though, and it certainly has allowed things to open up more again. So, I think that the first step is really the in-person travel, right? Establishing these relationships is something that Zoom helped us during the pandemic, but really establishing those relationships in person is key. And then yes, in general, the exchange between the U.S. and the MENA region in general has just increased dramatically over the last few months, I think, as opposed to when COVID first began.
So this is not your first time visiting an Arab country in the MENA region?
No, it's not. It's my first time in Egypt, but not my first time in the region.
So where have you been before?
Yeah, I've been mainly in the Gulf, in Qatar, Dubai.
Trying to implement the same project with telehealth and telemedicine?
No, this was previously. This was as part of my clinical veterinary life.
Oh, okay.
Yes,
all right.
yes.
So tell me, how do you see mega projects like this really affecting the healthcare systems in the MENA region, for example?
So it is, you brought up the word accessibility, and that's really what it's all about, right? And I think it's accessibility to the highest quality care possible in any region. And it's also the fact that there are shortages of these healthcare providers, shortages of these doctors everywhere in the world. And it really allows the redistribution of resources more equitably everywhere.
Do you know Egypt is one of the countries that has, regardless of the economic status or social class, lots of access to the internet? I mean, it's basic, even rural areas further out. Most of everybody has a cell phone and access to the internet, and it's easy, very good coverage in Egypt. So how do you see this fitting in with the whole idea of telehealth?
Right. I mean, there is a reason that we're here as opposed to other countries, right? And that's something about the African continent in general. They're the forward thinking in terms of how they've created different Wi-Fi networks. In the US we started with cabled Wi-Fi and started with all sorts of difficulty, then expanding that to more satellite-based coverage. And we know, looking at Egypt specifically, that's really where they've kind of leaped forward, right? They skipped kind of the interim step and really have made
excelled in that sector.
Yes, exactly, available to everyone.
Which is indeed key for such projects that are reliant on telecommunications.
Correct.
Right. I think that's all the time we have for today. I'd like to thank you very, very much, Dr. Apryle Horbal. Thank you so much for coming in.
Thank you.
And I wish you a pleasant stay in Egypt and best of luck. And hopefully we'll see you again back here at Now TV International.
Thank you very much.
Doctor. Thank you so much. Ladies and gentlemen, that's all the time we have for today's edition of Cairo Local Time. We do hope you have enjoyed it. You were in the company of myself, Angie Mehermani. Thanks for watching.